नमस्कार तुमको पूरे जनाक आपा स्वागत करचे आव विमेन्स हेल्थ विषय बायलमनशाल हेल्थ विषय आमगे फेसबुक लाइव असं आमगे रिनाउंड डॉक्टर कामत आमगेलो टू असाची कंसल्टंट गायनोकॉलॉजिस्ट अन्नी आज आमगेलो टू इम्पॉर्टंट एक टॉपिक करता असाची आम्ही एक इनफर्टिलिटी मस्त जन ट्राय करताची एक मदरहूड एक्सपिरियन्स करूक सॅड फॅक्ट एक पटी जायना सो हाजे विषय मस्त तुमकां कसले डाउट्स असला री तुमगेल फ्रेंड आल खातीर जो नेबर आल खातीर लेक्चर आल खातीर तुम्ही आमकां पोस्ट कोन कमेंट क्वेश्चन्स निमगीत सो डॉक्टर कसं आहे इनफर्टिलिटी म्हणटाची तितली गोतूस मात कसं ते ऍक्च्युली मोस्ट कॉमन असो पुरो कितले आय मीन कितले जना एक्सपिरियन्स करता म्हणजे एक इनफर्टिलिटी म्हाका मात्र एक हांव सुजावच्या जायना म्हूण एक लेखताची एक पटी सो पुराय जन लायक तुमगेला कसं ना पडे त्या केन्नाय दिसता तशें पुराय जनांक गूड बिल्डींग दिसताची चेडू दिसता सुतमुत सो कसं डॉक्टर या इनफर्टिलिटी म्हणा कसं and how common it is.
Okay. Before I start, एक disclaimer असं म्हणाले. How actually I'm not an IVF specialist. I'm a surgeon, laparoscopic surgeon. आमगेला तो स्त्रीरोग तज्ञान तो मस्त type specializations. कळवत. So general gynecology आणि laparoscopy या मेगेल स्पेशलायझेशन म्हणून हांव या प्रेग्नेन्सी जायनातील आणि पळयना म्हणून ना पळयता बट IVF करना बट द थिंग टू रिमेंबर इज दात जन तसले एक दंपती आस म्हणलं त्या ऑलमोस्ट 5-6 जनांक इजिली एट अ बेसिक लेवल ट्रीटमेंट करून सक्सेसफुल प्रेग्नेन्सी दिवयता. So first thing to understand is infertility is a very common problem. It is a very common problem. I will example that. Yeah, varsha beginning are 10 जन दंपती or couples pregnancy try करचा start केलं म्हणतात newlywed, let us imagine newlywed pregnancy couples. By the end of February, only 1 or 2 would have conceived. पूरा correct तन्नी संबंध लोड correct करता सच्ची तंग कसनी problem ना मन जलरी. Only 1 or 2 out of 10 would have conceived by say February or March. आणि by June only 3 or 4 would have conceived. By December only 7 to 8 would have conceived. Now there will be still 1 or 2 waiting to get pregnant at the end of 1 year. तुमका idea येतास ना? That 1 or 2 couple may have to wait for a year more. So आम्ही आता medical school आणतो आमका definition कसं म्हणून सांगतो infertility. एक वर्ष continuous म्हणजे एक वर्ष correct जाऊन prescribed manner or try करतरी pregnancy जायनी म्हणजेला त्यादा ना infertility म्हणजे. This is a very important thing to understand. कसला म्हणाले मस्त जन लागता कसं म्हणाले आम्ही next month आता मे ना जून जुलै से स्टार्ट करता by August pregnancy जायनी म्हणजेला they would consider something is wrong. But the reality is it takes time. It takes time because there are many factors playing a role here. There is a big chance factor. How a patient sangashi describe करचा how कशी सांगची म्हणाले getting pregnant after planning pregnancy is a bit like going to a fish pond. आता तुम्ही एका fish pond असं तंत fish असं मस्त असं fish तुम्ही वचून तुमगेल fish tackle गल्ली म्हणून झाला रे. There are several possibilities. Fish will bite in the next 10 minutes. That's your good fortune. But on a so-called bad day, you may have put your fishing tackle. You may be the best skilled person in fishing. There might be enough fish in the pond, but fish will not bite. And you will end up waiting till evening. And if your luck runs out, you may have to come back next day for. So just to give you an idea of how the chance factor plays a role. There are many factors. Chance factor is one of them. What we call chance factor could very well be subtle, sukshma molecular level or problems. These are very difficult to understand, poorly understood even by doctors, even by biologists. In other words, first thing अर्थ कोण घेऊ का कसं म्हणणारे कोणीही एक दंपती ट्राय करता म्हणतात फर्स्ट अर्थ कोण कसं म्हणणारे करेक्ट जाऊन एक वर्ष ट्राय करतरी एस्पेशली यंगर कपल ओल्डर कपल वाला चिके चढ प्रेशर असतं ते एक वर्ष ट्राय करून करेक्ट प्रिस्क्राइब मॅनर कसं म्हणावं येतात प्रिस्क्राइब मॅनर ट्राय करतरी Magiri pregnant jaini mundala, that is the time to consult. Now this is specifically for younger couple. Say the woman is less than say 30 years or 35 years of age. And man dharmanshal age titli important parnant, presuming is say above below 40. You can safely try for 9 to 12 months in the prescribed manner. Unless तुमको already कसं की problem असं म्हणून तुमको एक proof असं म्हणलं that's another matter. Prescribed manner try करू, you can continue to, then you can consult. So that is the first thing to understand. Second thing to understand when you go to doctors is things will take time. Like even if doctors see you today, they may have to see you repeatedly for 1 or 2 cycles, 1 or 2 months before they come to know what is going on, before they realize what's going on. Are you following what I'm saying?
Yes.
And several tests. So in other words, तुम्ही डॉक्टरला चमकल कुडले तानी immediately तुमका medicine देऊनो pregnant जाऊची unusual, they're rare and unlikely. So unfortunately हम तो मस्त patience जाऊ का जाता. Patience and understanding of science. How are we supposed to understand science? It is the doctor's job. But in 21st century, medicine is a joint responsibility. However much you like it or not, that is the reality. Because then this galiki doctor medicine ditta, those days are gone. Science is not black and white, it is full of shades of grey. So first biology अर्थ कोण घेऊ का हाँ तुमका ओके म्हणतला biology explain करता.
Of course.
Can I proceed? Yes.
Yes, doctor.
So first thing to correct. First thing to understand, this has come back, as you can see. This is my favorite model. Every month, a small egg starts growing. It grows like this red dot here. It grows here, say in a woman who is getting cycles every 28 days, this egg becomes large by around 13th or 14th day and it gets released. If it gets released, it gets into the fallopian tube. That time are samandavarli mandala. Viryantu, semen antu. Millions of sperms sit there, the microscope are gallery. Fishes, millions of these sperms, they get deposited here, hung deposited. Kade hung vair and deposit jalari hung vairion pouchi kevala daj or bar sperms. Tantu ek sperm, it's like a race, literally, between sperms. Ek sperm and egg join jauno, the tube anto. The pregnancy hangyo berur. And pregnancy turns into a baby. This is what is ideally, this is what should happen. But like I said, apart from the chance factor which I mentioned, let's go to common reasons why pregnancy doesn't happen as planned. If you take 10 couple, in 3 couple, the problem lies with the woman's system. In 3 other couple, the problem lies with the man's system. And in the rest, that is 4, we will never know why pregnancy doesn't happen. This is the most frustrating part of infertility. That means This is called unexplained infertility. Explanation na. In other words, Garbhakoshu, Andashaya, tube normal dista, tubes open asta, timer menses atta, egg release atta. Husband ala semen analysis kellari. Tantu, the sperm count normal asta. Sambandu correct davarta saji. Jalari pregnancy jaina. This is called unexplained infertility and occurs in 40% of couples who are trying for pregnancy. That means 4 out of 10. Ata sambandhadavara kshi kanchi time ardavarka. These are all common questions asked. First arth konge kasamlari. The release of the egg is unpredictable in most women. Malari though amme andajer 13th, 14th, 15th day jat mandalari. Mostly release of laklari. This is not set in stone. This can happen at variable time in the same woman in different cycles. Malari same bile months in different cycle onto different time are release of sadhas. Second, kasamalari, the egg life is just 24 to 36 hours. Malari 8 to 1.5 days with the egg nashita, the egg rapta, it will wait, it will get disintegrated or inactive at least. So in other words, to me, egg release 13th, 14th day jalari, samandhu davarlal 18th day jalari, for example, there is no point. Pregnancy jaina ta cycle for obvious reason. Egg tantu nashisi hogutadu. Vachunasta. Spermach life kitla, it can be alive up to 3 to 5 days in the tube. So there is a window period. So for a regular couple, non-medical couple who are trying on their own, it's very difficult to know egg kedan release kedan sambandha. So traditionally kasanchi malarami clinic antu at least varaka 3-4 dis ek dis son ek dis sambandha davarachi 3-4 dis ek dis son ek dis kasalaka daily sambandha davarli mandalari the husband will count chiki podo start dota temporarily, and that in theory at least may have effect on conception, but these are all not really proven in as hard facts. But typically amisanchikeshmari alternate day sambandho or approximately 3 to 4 times a week alternate day sambandho ek dis. This is traditional explanation. How sanchika samlari clinic antu ek note karta samlari, some couple get so stressed out about this intercourse on alternate days. Everything becomes medicalized. And suddenly what is considered pretty much normal biology, if you look at our other animals in the planet, if you look at, vast majority, even if you look at people from lower socioeconomic status, from poor background, well, they also get pregnant without any biological lessons, So in other words, you are looking at a very natural process. Too much medicalization in the early part of pregnancy may not be in the best interest. Especially kona sanchmari, tamgel GSP community in mainly IT professionals, engineers, they tend to lead a very stressed out life. That's my observation. Tantu kasat malari tangela, everything becomes medicalized. And also, tangela lifestyle change, that is a new problem that is coming up. I know that in last 3 sessions, I have come back to the same point. If you notice, it is that there seems to be a lifestyle issue in many of the things. Lifestyle issue correct. Ek unique observation. This is an observation I noted, interesting observation I noted only after coming to India. Kasa note kelma many couple, they come within 1 to 2 years of marriage and they say we are struggling to conceive. And I note karta suddenly menses irregular jav start late jav start I mean nimge palai kade palayalari sama nimge lari at weight palayalari 74 hours. 1 ವರ್ಷ ಪಡೆ marriage apod kitla weight asila 64. In a matter of within a year, they've put on about 10 kilos. And I don't know why that happens. We can theorize. It could be that up to the point they get married, they're very conscious about their weight. And, getting married is a challenge, and they have to appear, slim, appear correct. So maybe they take very good care of their diet, and, they focus on that. Suddenly that motivation is gone once you get married. The motivation not. Second, there is a tendency to feed new couple. That is one thing I observed in our community. There is sort of they call and they go to different.
Wait.
It's something like that. And not only that, the couple themselves move around and eat a lot of fast food. It's not just that it's cultural. There is a lack of control over everything. And suddenly the woman would have put on, man also would have put on, but the mana vaititli parinamyana, interestingly. But the woman's cycle is very sensitive to weight. So weight gali kudle, even
weight is one of the reason, my doctor, for infertility.
Correct. That is one of the reasons. Correct. If you are able to, this is one of the factors which is in our hands. That is what I'm saying. Not everything is not related to weight. But Miguel, again, as you might have understood, this program is not for detailed treatment plans. This is to tell you what you can do sitting at home to help yourself.
Awareness. Yeah.
Correct, Nova. So first thing to remember is if you are overweight, lose a few kilos, even even 4 to 5 kilos weight loss does help if you are overweight. If you are already of normal or underweight, that doesn't apply. And that is one thing that helps. Second thing that helps is have better marital relationship, like have more time, work-life balance, have more time. This is particularly for men because again, my observation is often there is no time for married life. So as a result, intercourse becomes everything on a calendar, on a Google Calendar sort of approach. Everything becomes medicalized. Stress started, sexual dysfunction started. This is a very common observation. Then it is a vicious cycle. One thing leads to another, and gradually there will be more and more tests. Everything becomes a misery. Ekikpati palaitan bachar jata itamari 7-8 ವರ್ಷ ನಂತರ they would have seen at least 6 to 7 doctors. Tangel file go through kuru ka amke ekikpati 2 घंटा लगता. इतने complex is the history. It is so complex that you lose the will to live after going through those folders. And I feel incredibly, it's heartbreaking to see them. Still, they come with hope, even after going through immense process of. So, Miguel, kasan understanding malari. Initial stage are correct steps kalli mondalari. Probably much of this misery can be avoided. I know I have to criticize our own profession sometimes. Maybe our doctors don't give enough time to explain these things. It is possible. I have no evidence, but I suspect that India, the number of patients each doctor ends up seeing is enormous. The quality doubt maka. So therefore, there is often no time for education, and doctors also somehow give medications and hope things will work out. But in reality, like I said, a good understanding of basic biology is a must for couple who are struggling to get pregnant. First, we don't involve doctors unless you are totally sure of that there is a problem. Focus on focus on lifestyle.
नहीं तुम्ही हे सांगता ना खंयचे exact like very good age to start planning to be pregnant, doctor?
Okay. That's a very good question, but I would not venture to answer it in 21st century. Itamari, for example, there could be professional women who want to start much later. There are like in the UK where I was a consultant, many women started planning at 35 years, which is considered perfectly acceptable. And but you must understand that the longer you wait, there is no one word answer, unfortunately, but the longer you wait, more are the problems. For example, what problems can occur as you wait longer? As I said, let's imagine a bowl full of 100 apples. Let us imagine a bowl. Okay. Now, out of those 100 apples, you have 80 good apples, say grade A apples, say 15 grade B apples, and then 5 grade C apples. Now, if you were to go every day to pick one apple, you are likely to pick the best apple. Not always, but most of the times. So after say 70 or 80 days, say if you take a survey of what apples are remaining, you are likely to find most of them are grade C or grade B. You'll still find some grade A apples. What I'm saying is every woman is endowed with a limited, sorry, I'm speaking in English, but I would mix up now. Every woman is endowed with a certain number of eggs. Some of them are so-called good quality eggs. Good quality eggs, these have the right genetic materials, right architecture, right things. And they seem to be getting released first. Managel. So, Kasajat Malari, first few years, say after 18, like I said, the marriageable age, the adulthood is from 18 years. I think, as far as I know, legal marriage is not allowed before 18 years. Yeah, and therefore, so let's assume 18 years you start planning pregnancy. The best eggs are released in the first few years, and as you approach 35 years, the number of so-called good quality eggs reduce. They don't disappear; they reduce, and then the old say B and C type of eggs are what remain. And at 36 years, these the so-called grade B or grade C eggs, they tend to not get pregnant easily. And even if they got pregnant, occasionally, say 1 in 100 cases, say at say 36 or 37 years, the baby may have what's called Down syndrome. Down syndrome. Down syndrome on Ikalaska. Why?
Yes.
This is a chromosomal problem with the learning disabilities and so many other problems. So, chromosomal problems chances by 40 years, 1 out of 25 women could be having that kind of pregnancy. So, as the age approaches 40 years, such pregnancies increase. Of course, the good news also is that there are special tests now which can help us identify such pregnancies very early on. Yeah, very early.
4 months.
But what? Kasana?
That test?
Kasana 4 months, man.
No,
test can be done by within the first 8 weeks. Find out simple blood test. Why? That DNA. Vamshavayini, mother circulation aspun pick kormu kadchi test blood test. It's expensive, costing about 25,000-30,000, but it is 99.99% accurate. Simple blood test. Nice. So things have changed dramatically, but still you are taking a small chance. As you wait longer, diseases start especially endometriosis conditions. Endometriosis is the problem of 21st century. Endometriosis and Miguel patients and Samachi, the pura audience I'm particularly keen. Endometriosis lining us now uterus lining. Then every month, because of hormonal influence, hormones released from ovaries, this lining grows, and at the end of that month, whatever lining is that is shed. Whatever lining is that shed, then there comes menstrual blood. 1 out of 10 women might actually have this blood spill, not blood but tissue, spill into the pelvis by Hangada Kelaman Magiri tube antu Hangapura Antum Basta Magiri Hajeri Antum Basta Hangada Kelaman. So pura Antum Basta pura damage karta. This condition is called endometriosis. This is getting increasingly common. in 21st century. As I said, sometimes the disease is so severe that there are occasions where I've operated for hours together to clear up the disease. Again, I don't want women to feel guilty. Many
Yes, I
women
wanted
feel
to
I
ask
have
that.
wasted so many years and that's why I have endometriosis. But there is no easy answer. Like, I have a daughter who is 20 years old now, and she wants to do well in life. She also wants to have pregnancies and babies, but she also wants to do well in life. Now, there are no easy answers. This is the challenge of 21st century, which I keep coming back to always. There are no easy answers, but first thing to understand is you need not feel guilty just because you have ended up with endometriosis and you postpone pregnancy. That is life. If you look at it philosophically, it is not easy decision to make. And postponing pregnancy because you want to do well or you have some compulsions, personal compulsion, is perfectly understandable. Yes, you wanted
But
to
I
ask me a
wanted to
question.
ask, yes, I wanted to ask whether दार्लुमनशाला एज मॅटर जाते की आता तुम्ही म्हणाल या पुरे बायलमनशाला एज तांगेल एग्स पुरे तशी दार्लुमनशाला
Yeah,
इज इनफर्टिलिटी ओनली वुमेन्स प्रॉब्लेम की कशी म्हणजे मोस्टली वुमेन ब्लेम करतात सो
good.
दार्लुमनशाला
Exactly. Yeah, very good question. But that comes to the very heart of what our society is. That comes to very heart of what our society is. In other words, um, first of all, men, as I said, male factors contribute 30% कसं म्हणची तुका difficulty in conception. Okay, 30% of problem. The most common problem is count. Count is a very tricky thing to understand. कशाला म्हणारे आता 1 ml semen आणतो. You should, if you go by World Health Organization standards, you should have at least 15 million sperms. But does it mean if you have 14 million, it's a problem? Does it mean if you have 10 million, it's a problem? Not necessarily, because remember, ultimately you need just one sperm to get pregnant. But problem is that the statistical chance of one getting pregnant with as the count reduces, that is the problem. That means I have in our own clinic, surprisingly, couple do get pregnant. We find we get surprised that they had just a count of 1 to 2 million and they would have come back pregnancy on their own spontaneously. Even as we were thinking of referring them or planning IVF or whatever, they suddenly fall pregnant. So what I'm saying is, if the count is low, it doesn't necessarily mean that a couple cannot get pregnant. Now coming to the social issues, now which you mentioned, is it a woman's problem? Of course not. It's not a woman's problem. It is a problem. I would call it, first of all, it's a challenge. I don't want to call it a problem. Like I said, even if pregnancy doesn't happen at all, because my personal view, we should not consider it end of life, end of the road. There are many things we can do in life which are productive, which can contribute to society, which can give us good quality of life. The old traditional way of looking at life, where children are the only way to prove to the world that we are happy, perhaps we should start rethinking on these issues. But as far as the yes, blaming the woman, I feel it's criminal behavior to blame a woman, even if perchance you find that it is a woman's factor that is contributing. It's not a you and me game. It's not, you follow what I'm saying. It should not be that sort. But you sometimes see that, especially in, unfortunately, I must again come back to this. I find it more common in GSP society. This is a little bit of a hard thing to take, but I find that in many these issues, our society is pretty orthodox, unnecessarily orthodox, unnecessarily harsh on women. Because in reality, men also have problem, and it's not as if men are criminal if they have low count. Of course not. As I said, pregnancy is teamwork, and it is not and should never be blame game. And if a woman is harassed on account of infertility, I would classify it as criminal behavior on the part of that family as well as the society. Absolutely unacceptable. already this couple and that woman is going through, especially women, they go through a lot of invasive tests to go through this, treatment process. And to say, oh no, and doctors, we also, I don't know, I don't think any of my colleagues listen to this program, but if they do listen, all I say is, my request is never ever say it's a problem with the woman or a problem with the man. It's better to say it's a problem here in this whatever biology. It is not a problem, a woman's problem or a man's problem. It is a problem or a challenge, you can say. I would say it's more like a challenge for us to overcome in these areas.
मस्त लायक थॉट सांगले डॉक्टर. तशीची आमगेले एक व्ह्यूअर आनी निमगेला एक क्वेश्चन मेल इनफर्टिलिटी तो अजूस्पर्मिया which is genetical या treatable वा म्हणून निमगेता आसाची.
Genetic azoospermia. Okay. Genetic azoospermia cannot be, I don't think it can be treated. Now, of course, it's very little information for me to speak on straight away. But to put it in simple terms, if it's a genetic reason for azoospermia, I think it's not possible to get a sperm. Azoospermia, first of all, for other public, I'll say azoospermia is where no sperms are seen in the semen sample, at least in 2 samples. That is azoospermia. Now, there are many reasons why you do not find sperm in the system. It could be that the testes, the bija, that is not, for some reason it has stopped functioning. It could be genetic reasons like some viewer is mentioning. It could be that those sperms are produced, they are not flowing in correctly through the tubing system. So that means there is a block in some channel. So these are common reasons. This could be some of the reasons. But generally speaking, if azoospermia, like if one option is to check and see if sperms are there in the testis, it is possible to extract sperm directly from the testis and do an IVF. If that is not the case, and if that is often the case when you have a genetic reason for it, then I think one may have to consider some alternative options. I'm not prepared to say on this channel for about alternative options because I'm not a specialist in that. But all I can say is there are alternatives available. That you have to consult an IVF center, and generally speaking, IVF centers have who are called andrologists. Andrologists, they are urologists specializing in male infertility. So they will help you.
Okay. तशीची आता तुम्ही सांगला 40% इनएक्सप्लेनेबल इनफर्टिलिटी म्हणून. सो कशी तुम्ही या पुरे डायग्नोस करताची त्यांनी या कॅटेगरीन तू बिलॉंग करताची म्हणून और इनफर्टिलिटी ज्याला म्हणून कशी करता. सो couple may not be trying hard or whatever, त्यांनी स्ट्रेस जाऊन ताजी निमती जायनी असतला. सो कशी डायग्नोस करता डॉक्टर?
Very true. Why? First step is, of course, a good history. Again, this is where many of us fail. Good history. First, we have to listen to the couple. We have to ask a detailed medical history, menstrual history. Tangel height, weight, tangel obesity as well. Proper scan korka. Typically, the scan kashi plan korche. It's a vaginal scan, unlike regular scan. Vaginal scan kasana. To regularly तुम्ही स्कॅन सेंटर चमकला वेस्ट कोण स्कॅन करतो. वेजाइनल स्कॅन म्हणारे जंटली हंगे का स्पेशल प्रोब कन भितर कोण स्कॅन करतो दू केसना त्या स्कॅन करून गर्भकोशाची परिस्थिती कसं आहे, अंडाशय परिस्थिती कसं आहे, एग ग्रो जाता स्वयंगा त्या पुरा आमका स्कॅनर कळता, ते हिस्ट्रीन कळता. प्लस वी ऑल्सो टेक अ सीमेन एनालिसिस. आणि तुम्ही सांगला म्हणकेची त्यांनी कितली पटी संबंध वर्ताची. Sometimes you'll be surprised. 2 things I've observed. One is frequency is very less, like once or twice a month because of work pressure, lack of marital issues, stress pura. So if you are having intercourse, only intercourse means daika sampark once or twice a month chalari. As I said, first of all, pregnancy is a matter of chance. Then your egg is going to live only for 24 to 36 hours. So you are unlikely to catch that egg when it is released if you have very infrequent intercourse. Second, एक नोट करता समरी संबंधದ वर्चಕ ದಲ್ಮಂಚಲಂತು एक पटी तंका इरेक्शन प्रॉब्लम्स या पुरा स्टार्ट या पुरा असता. सो संबंध करेक्ट जाता असना. सो तक पर आम्ही करेक्ट हिस्ट्री घेऊ का तांकां परीक्षा करता निमू का संबंध जाताच की ना करेक्ट म्हणून या पुरा these are sensitive, complex, difficult processes. Then we also ask for certain hormone tests. Basically, after evaluation of all this, say over 2 to 3 months, we find no specific reason for why pregnancy is not happening. Then we call it unexplained infertility. Of course, at some stage later on, we might still find an explanation. But to start off by saying unexplained infertility, it helps us to know if we have to, say, consider IVF. Or can we allow them to try on their own for some more time before we decide on IVF? IVF is in vitro or test tube baby in vitro fertilization. So I hope I have given you a certain overview of what happens when a couple go to infertility center.
Yes. तशीची तुम्ही म्हणता असताना कशी डायग्नोज करताची तांकां थोडे टाइम दिता समन करूक ह्या क्वेश्चन हांव आमगेले केलो जनाल खातीर निमगीत आसा सो सर्टन पोजिशन डज इट हेल्प इन गेटिंग प्रेग्नेंट
No, there is again these are all magic myths which keep going around. No, truth. People do think about all these things, but in reality, having my question is, like I said, if you look at, say, a population from, like you said, say manual labor population, you find they're getting, many of them are getting pregnant without difficulty. They don't talk about all these things. What I'm saying is there's nothing wrong in talking about these things, but there is no evidence that whatever the position, these things have no relevance, no evidence, scientific evidence that this position will work better than that position. More important, like my request to the audience is focus more on good marital relationship. That is important. One thing, the greatest casualty of 21st century is a good humane marital relationship. If you notice, women are particularly at the receiving end of this particular problem. They have an independent mind because of modern education. They're exposed to social media, they're exposed to the outer wider world, but their in-laws, their immediate society puts a lot of pressure on them, compels them to think traditional. So this conflict leads to a lot of distress. I think this is my observation. And second kasa problem jatas malari tencha mala mankechi the marital relation suffers because of lifestyle as well as work pressure. To the extent that the man, Sangesh.
तशीची पोझिशन मंकेची तशीची मिड सायकल लाईक तुगेल मेन्सेसा मध्ये व्हॉट आर द बेस्ट वेज लाईक तुम्ही म्हणाल अल्टरनेट डेज ट्राय केल्यार बेटर म्हणून बट कसले जो मध्ये दिवस जो खंयचे इम्पॉर्टंट डेज वेर दे हॅव टू दे कॅन ट्राय
Correct. Then the question, yes, good question. But then the question comes, why are we asking these questions? Because that means, are we zooming in on only that day when that is the perfect day to, sort of try for pregnancy? That means something is wrong with the marital relationship. Are you following what I'm saying? Yes. So you have to go back to the drawing board and see, why are we having this conversation in the first place? Why are the couple aiming for one particular day in the month to have intercourse? Which means their marital relationship may not be working fine. So it's time to say, okay, let's sort of take a step back. Let's not take on this new project, which probably we don't need to. Are you following me? Let's close the shop a little bit earlier. If you're, say, working in a shop or working, let me not take home, or let me switch off the laptop and social media and spend some time together, watching a nice movie, talking. That, in other words, what I'm saying is, if you spend more time in marital relationship. Now, again, I'm not a marital counselor, but this is my observation.
Yes.
Like when I see couple, I tend to talk to them. I love to listen to people, and when I talk to them and when I listen to them, one thing striking that I see in many couples is they ask about these questions. Like position, of course, is not that common, but this timing, like which day is absolutely spot on, which we have. It's like a jackpot. to get it.
आणि एक पटी चले चलडू काही एक कसं की चायनीज कॅलेंडर या कॅलेंडर पुऱ्या
Okay, this chilla childu. Again, it is criminal to think by law itself. First of all, अनेक सांगता हूं तुमका कसा म्हणा again this may be hard for GSPs to take, but I find it mainly in GSPs. Sex treatment. Imagine, 21st century, we consider ourselves a more relatively a more advanced community in the country. I think that's a myth, because as I see, still there is an obsession with boy child and girl child. Why this obsession is something unbelievable. That is why our society doesn't progress.
Correct.
Are we saying that a boy child is better than girl child? Absolutely crazy. I mean, that's what, and why are we considering ourselves something special community in the society, you know? So I would criticize GSB community directly through this forum. If you're thinking of discrimination, even before that little baby is born, it is criminal behavior on the part of that family as well as that society. So I hope that message is very clear.
Yes, doctor.
Very clear. Even if you're checking on Chinese calendars, you're checking for special diets, you need to get yourself checked, not down there, but up there.
Yes.
I hope that is brutally honest. Yes. Okay.
Yes, very true. Very well said, doctor. मस्त खुश झाला. Maybe आमगेल religion अंतो मस्त custom चला न करचा. I don't know what's the reason, but as you said, I hope the message has reached to many of our viewers that both
but
are
again, like if I tell you my views on these issues, this will be the last program you'll be inviting me.
No, see, we got a lot of claps from our viewers and they gave thumbs up to them. Anyway, happy with your statement, especially ladies. So, yes, hands off to that statement.
Yes. Thank you.
तशीची आमकां तुमी IVF करता आसता लास्ट ट्रीटमेंट आसताला बट ताजे कुशी पुढे कसं पुरो येतानी ट्रीटमेंट ट्राय करीत डॉक्टर to conceive?
Yes. First step, like I said, let's put it into 3 stages. Okay, 3 stages if you're struggling to get pregnant. First step is see whether it's simple measures, like maybe you're not having intercourse regularly enough, maybe your marital life is not okay, maybe you've put on weight in the last few months and you have time. Like if you're closer to 35, you may better off going to doctors sooner, but suppose you have time on your side, it's perfectly, and you feel everything is fine, you're getting regular cycles, there are no sexual dysfunction, your husband is also fine in terms of health, so there is no need to rush to doctors. Just spend time having good timely intercourse, like we mentioned. Don't make it medicalized. Spend at least 6 months to 12 months trying on your own peacefully without getting pressure. Another advice to GSP community again, do not tell your family and friends that you're trying. I repeat, do not tell your family and friends that you're trying.
They ask
you will
openly,
get
probably.
you will be asked 100 times, did you get your menses? Why didn't you get your menses? Why did you get your menses? It's time to go to doctor. That is how problems start. So first step, try natural. Okay, that's for 6 to 12 months. Now next step, when you go to doctors, should you go directly to IVF center? Well, your choice. Like you can inquire and see which side, but generally speaking, IVF centers are highly specialized centers. It's okay to go to them, but there are no guarantees that they may just say, let's try IVF. So best is to, what I would say is, go to your general gynecologist, your family gynecologist if you have one. And they're expected to take a history. They may ask not too many tests depending on what you're saying, and they definitely will ask for a scan. Most important question you have to ask after say 2-3 months of evaluation is, what is the reason for conception? One of the things I noted after coming to India is, when I ask couple, they would have carried a folder where they have seen many doctors. What has the doctor told you is the reason for not getting pregnant? They have a blank look on face. Now, is this a problem with the doctors not telling them what's wrong, or is this a problem where the couple themselves don't apply their minds to understand what's happening. I think it's a bit of both. So my suggestion is you have a conversation with your doctor and really ask them why things are not working out. What is the biological reasons why things are not working out? There could be 1, 2, 3 reasons. Okay. If there are no reasons, you should know that there are no reasons. This is important. Are you following what I'm saying?
Yes.
Once you know what the problem is, there may be a solution to it. Here the problem is they go to doctors do tests, prescribe medicine, they move on, this plots on, then things don't work out, they go to the next doctor. By now they would have accumulated, by the end of say 3 to 4 years, they would have accumulated something like 3 to 4 folders, lots of tests, and practically run out of savings, basically. So my suggestion is that have a conversation with your doctor. Try to find out why things are not working out biologically. Remember, doctor is not a salesperson. He or she is not sitting there to give you goods to get pregnant. His or her job is to think for you, is to analyze, to understand. When you understand, you have a solution. Now, if you are not succeeding, say you feel the doctor has done her or his best, he has explained everything, you finally things are not working out, say after a reasonable try, resist the temptation to doctor hop and doctor shop, unless you're sure about what's going on. Okay, like first choose your doctor well, choose a doctor with whom you have a good rapport, you connect well. Now, once you feel that's the case, stick with the doctor for a while. Try to understand what's happening. Now move on to a good IVF center if things are not working out. Okay. Now IVF is a tricky sort of thing. Many people think IVF is the last and the final and the absolute solution. You must remember that IVF has its benefits, but it's got its drawbacks as well. Drawbacks are severe because the woman especially has to go through a real washing machine, ringer to go through the, IVF. I'm sure the viewers who would have gone through it would know, like multiple injections, multiple scans. This practically you will be ripped off, but not by the doctors. I'm not saying doctors are ripping you. The system, the process, it's very intense, very intense. Not always, sometimes it's very intense. Plus, it's heavy on your purse. Will make you poorer by 2 to 3 lakhs. And the heartbreaking thing is that it works only in the best of scenarios, works only in 1 in 2 couple. That means if say 4 to 5 couple had IVF in the month of May in a center, only 2 would have conceived. So at the end of that, you could be heartbroken and broken in terms of wealth as well, depending on your ability to afford it. Now, once you have a failed IVF, then question comes: do we do more IVF? Just let things go, or consider adoption? An advice to couple who are trying for IVF is: first, always take the possibility that things will. What happens if things didn't work out? Always consider that possibility. Like human beings are always used to the best case scenario because we are optimists by nature. Indians tame any best case scenario mat think korchu. In fact, we are not even allowed to say anything negative in our society. Are you following what I'm saying? So negative failure, but in reality is failure IVF failure, the woman takes it pretty seriously and she feels guilty, she feels heartbroken. This is my observation. Yes. Society would have made you feel like that at the end of that process. Sad, but truth. But my observation for example, I observed British society. It wasn't that bad. Societal pressure nahi. Personally, but they take it and they stride. I sometimes wonder, why is that society so different compared to ours? I don't know. I still don't have answers. I mean, I do have answers. Again, if I say these answers, this will be the last program. I'll be booted out of your Youth of GSB program. So,
Can we have you for debate?
So what I'm saying is, my request, like I said, if my daughter, who is 20 years old now, say postpones her conception till 35 and ends up with endometriosis and ends up with the problem, I'm going to tell her it's okay. You are, at the end of the day,
End of the one.
you are an honored, dignified member of this society. You have a lot to contribute. So first of all, this is my request to every woman: you work in a way that you feel lead a fulfilling life, first of all, that you truly contribute to your society, not in terms of money, but in terms of your resources, your intellectual resources, your service. It is greatly appreciated. But if you have a baby and this is your pleasure, of course that is great. But if that doesn't work out, not it is not it should not be, you should not be made to feel sad and heartbroken. There will be some pain, but you should not be made to feel heartbroken by the society. It should not be coming from the society, it should not be coming from the husband, should not be coming from the folks around you. Are you following what
The
I'm
family
saying?
members. Yes, absolutely.
Yes.
सो तशीची तुम्ही म्हणला IVF पकन त्यावेळी जायना जरा मागीर एडॉप्शन की कसं तर एडॉप्शन हेची की आमगेल सोसायटीनची की म्हाक्षी आसतला बट एडॉप्शन करचे जाल्यार आतां आमगेला इंडिया तू आमी रेजिस्टर केला रे कितली की नंबर कितली की वेटिंग लिस्ट आसता सो तांकां डायरेक्ट मेळचे ना सो व्हॉट इज योर से तुगेलो
Miguel advice कसं, opinion कसं म्हणणार आहे, it's better you choose to go for adoption sooner than later. Kasala Malari, it's not that you can't adopt later. The problem comes you may have end up adopting a slightly older child, which is actually great. It's fine, but some couple may want a little younger children. So it's a bit like that. It's a waiting process and it's a legal process. I agree with the legal process.
Okay.
Why, whatever. I wish there was a more streamlining on these issues. But yes, Miguel advice generally, don't keep it till you're 40, 45, because when you want to support that child till that child is into university or when the child is independent, and life can be sometimes brutally short. So my suggestion is, so if you feel things are not really working out and you've had 1 or 2 IVF failures, that's time to actually not hesitate to adopt. I strongly encourage adoption. You will give a beautiful home to a little girl or a boy who has lost parents. It will be a great idea. Adoption is a great idea. Again, I wouldn't hesitate to recommend it to my daughter.
Yes, that's nice. Tashichi, amgile viewer nimgila, what is gestational? Please ask about gestational diabetes.
Yes, good question, but that comes slightly out of infertility. But put it in simple way, diabetes, it is not the same diabetes that you find in background population. It is diabetes that you find during pregnancy and because of pregnancy. You see the difference. It doesn't hurt the mother, basically. It mainly causes problems to the pregnancy, like the baby grows a little bit bigger than usual. The baby is when the diabetes is not controlled. This gestational diabetes is nothing but pregnancy related diabetes. Gestational diabetes or pregnancy related diabetes on most occasions can be easily dealt with by simple dietary measures. But if the mother's sugars are not controlled, there is small chance that the baby could suffer. Very rarely, baby could be lost in the mother's stomach. This is very rare, but I hope I've answered that question.
Yes, doctor. आणि एक लास्ट मस्त IVF सेंटर असता, यू कांट ट्रस्ट इतली पुराय खर्च करून पुराय तुमगेल ओपिनियन रशीची इफ यू हैव टू सजेस्ट वन IVF सेंटर खंयचे आसतले?
Okay, this is a very loaded question, but a very fair question. First हांव सांगची कसं म्हळ्यार, first हांव सांगची कसं म्हळ्यार, whoever is going for, I can't recommend one over A or over B, but I can tell you how to go about it. First thing is understand as much as possible what your problem is before you go to an IVF center. Like that means your doctor who has been seeing you should help you understand what has happened, or you make an effort to ask and understand. And if you still can't get, you can use internet. There's no problem checking. Like many doctors are not happy that patients are checking internet. I am perfectly okay with people checking internet. I myself check internet for many doubts which I can't get. It is the reality. So check internet, but make sure that when you check internet, you go to reputed websites. Reputed websites. There are certain non-profit organizations like the European Society of Human Reproduction. I can't tell you right away, but you can find out. You can find out there are some good websites which give very good information for patients. There are videos, and these are all evidence-based, science-based advice. So तुम्ही अर्थ कोण घेऊ का? First अर्थ कोण घ्यायचे? ज्यात तिथला अर्थ कोण घ्यायचे? Second कसं म्हणणार आहे? Take a proper referral from your doctor. Now, referral should be open referral, ideally. Of course, if the doctor says, no, you go to this IVF center A, I will make sure that you are taken care of, that is great. But otherwise, how Miguel patients are, I will tell them, go to center A, B, C. Like I will recommend 2-3 centers around, or one center in Bangalore or something. Now you go around, you take your letter, take a consultation. Now, if that doctor takes time to understand what your issues are, explains everything, decides on a clear management strategy and puts everything on paper, that would be ideal. That means they should understand what your issues are. They should make an effort to make you understand what the issues are, and you should feel comfortable dealing with them. Don't just look at their bill. It's okay to spend a little bit more if you feel this. Yeah, and if a IVF center is promising 100% success, I think that may not be accurate. But tasal kone na Miguel pura colleagues nobody is bombastic like that. Vast majority of them are really conscientious. Mistake problem must misunderstand IVF center it's a money making business. In reality, it's every time that pregnancy doesn't happen, that doctor also has a heartbreak. That doctor has a heartbreak, but they can't weep in front of you. That's the only difference. So you have to go to communication poor. Ekka problem country communication must poor doctors and patient that hopefully will get better. Communication improve satisfaction improve. So tumi 3-4 center polan you have to take a call on which you felt were understanding your problem better, were able to communicate, and were giving a plan which is important, plan which looks reasonable. Yes. And we will give you a realistic idea of what your success is. Yes. Though I said 50%, it could be 20% in some couple, it could be 80% in some other couple. So the realistic understanding korno, evaluate korno, thorough korno, respectfully tumko dignity divnu, padayala IVF center choose korno. Are you following? Yes. Of course, I understand that you can't get everything in one place, but you don't think feel that okay, this B is actually doing much. Their approach is much more sensible, much more scientific, and they seem to be more realistic. Their efforts are correct. Their bill might be a little bit more, but they are more likely to give me success. But don't expect 100% from any center. Itamari sadhya no. Be ready for a possibility that couple sang. If you have to take a loan to go for IVF, think again. There is a 50% chance that you're flushing the 3 lakhs down the drain. Damn, very painful. After 2.5-3 lakhs and misery and scans and everything, you will get a negative pregnancy test. It's extremely painful. To the extent I've sometimes seen patients negative pregnancy, they don't even talk to you for a while because they're not because they're angry, they're just frustrated, understandably so. But sometimes I feel you should prepare for that right from the beginning. It's not easy, but okay. It's a possibility. It's a reality.
Thank you, Doctor. Must like thoughts the large thoughts to ponder manita. So must bailman shankanga sanguk sulabastala, but then yes, त्या एक एंड ऑफ वर्ल्ड नाही आणि मस्त मालगड कोण पुराय पळयता आसा ह्या प्रोग्राम तांकां सपोर्ट करता एनवायरमेंट एक लायक सपोर्टिव्ह असला री आय थिंक तांगेल स्ट्रेस तांकां पळोवचें एक लायफ इट्स ओके जाय न्ही जाल्यार संतान जाय न्ही जाल्यार चेडूं जाय न्ही जाल्यार इट्स ओके आणि मस्त
Yes.
मेथड्स येता होप्स तशी दवरिता तशी पुराय मस्त पुराय डिस्कस केलेलं असं तुमगेल टायमा खातीर मस्त धन्यवाद बिझी स्केड्यूल असेल डॉक्टर हॉस्पिटलांतल्यान जस्ट आयली की म्हणून आणि डायरेक्ट
But it's busy now. I'm not a busy doctor. Only I focus on quality. I don't run around a lot. I have good work-life balance. I'm not a busy doctor. It's just that आज second केलेलं surgery हांव पळोवका जालें म्हाका उपाय नातिल्ले. I have to make sure she's fine and before she goes home. So otherwise I have lots of time on hand.
थँक यू डॉक्टर
Thank you.
थँक यू व्हेरी
Okay.
मच आणि नेक्स्ट संडे आपास एक इंटरेस्टिंग टॉपिकार येता तेच आमी विमेन्स हेल्थ प्रोग्रामांत सो थँक यू सो मच तुमगे व्ह्युअर्सान सपोर्ट केलेला का मस्त जनान थम्स अप लाइक्स
Thank you.
दिला थँक यू फॉर
Thank
युअर
you.
टाइम
Bye.